Thank you so much for taking the time out to join us as we talk to you about the power of tracking expenses for today's webinar. My name is Shahida Brown, and again, thank you for being with us today. The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via Audio Broadcast Panel. If you accidentally close the panel, you can reopen by going to the Communicate menu at the top of the screen and choosing Join Audio Broadcast. If you do not have sound capabilities on your computer or prefer to listen by phone, dial 1-650-479-3207, event number 664-746-198. You do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize other panels like chat, Q&A, and/or participants. Please use the chat box or Q&A box to send any questions you have during the webinar, and we will direct them accordingly during the Q&A portion. If you are listening by phone and not logged into the webinar, you can also ask questions by emailing them to sbrown@ndi-inc.org. Please note, this webinar is being recorded and the materials will be placed on the webpage www.realeconomicimpact.org/our-work/financial-counseling. If you experience any technical difficulties during the webinar, please use the chat box to send a message to Shahida Brown, Project Coordinator, or email her at sbrown@ndi-inc.org. With that, I'm going to turn it over to Maria Halamero. Thank you.
Good afternoon, and thank you again for joining us for this webinar. We'll start by sharing information on Empowered New York City and on the partners that are part of this initiative. So Empowered New York City is a groundbreaking new partnership dedicated to improving the financial stability of New Yorkers with disabilities and their families. The initiative will create, test, and promote new strategies to enable New Yorkers with disabilities to improve their financial stability. It will include broad engagement in education, which is being done through webinars like this one, as well as tailored one-on-one financial counseling, which has been enhanced with new expertise, outreach and tools, and specialized benefit support services. Some of the partners that are part of this initiative include New York City Office of Financial Empowerment, the Mayor's Office of People with Disabilities, City Community Development, National Disability Institute, the Mayor's Fund to Advance New York City, Post's Family Foundation, and an advisory board of municipal offices, and other experts that are giving advice to the project. I would like now to introduce to you some of the partners that are joining us for this presentation, and they include Wanda Lopez, Assistant Director of Special Projects at the New York City Office of Financial Empowerment, and Abby Meyerhoff, Program Manager, New York City at Work in the Mayor's Office for People with Disabilities. I'll pass it over now to Wanda.
Thank you, Maria. I just wanted to give you a quick overview on the New York City Department of Consumer Affairs. We protect and enhance the daily economic lives of New Yorkers to create thriving communities. DCA, as we call it, licenses more than 81,000 businesses in over 50 industries and enforces consumer protection, licensing, and workplace laws, ensuring truth in advertising and that New Yorkers are able to take paid leave for sick time to care for themselves and for their loved ones. Within DCA, the Office of Financial Empowerment is the first local government in the nation with a mission to educate, empower, and protect those with low income so they can build assets and make the most of their financial resources. And one of the largest programs is the Financial Empowerment Centers that serves in over 20 sites across the city. So through financial counseling, we've served over 50,000 New Yorkers, and through our tax season services, free tax services, in partnership with various community-based organizations and 200 sites, we have served over 500,000 New Yorkers, helping them file their taxes and save money. So we're excited to be a part of the Empowered NYC initiative, and with that, I will turn it over to my colleague Abby Mehrhoff at the Mayor's Office for People with Disabilities.
This is Shahida, and I will be stepping in for Abby. NYC Mayor's Office for People with Disabilities works to ensure that New Yorkers with disabilities can lead happy, healthy, and productive lives. NYC at Work connects people with disabilities to meaningful living wage jobs across 5 boroughs. MOPD improves services and programs for the over 920,000 New Yorkers who self-identify as people who are living with a disability. The Mayor's Office for People with Disabilities have 7 pillars that they focus on: transportation, education, access, health, housing, financial security, and most importantly, what's at the center of all of that is employment. The first public-private, NYC at Work, the first public-private partnership for employment for New Yorkers with disability, innovative cross-system approach to building a sustainable pipeline of qualified talent to meet the needs of businesses and high-growth industry jobs across NYC, business-led and business-driven initiative. NYC at Work is a collaboration among providers, businesses in high-growth sectors, vocational rehabilitation, schools and colleges, and NYC government. With that, I'm going to turn it over to Maria.
Thank you. City Community Development is also a key partner in this project, and they lead city's commitment to financial inclusion and economic empowerment for underserved individuals, families, and communities across the U.S. Through innovative collaborations with municipalities, community groups, and leading nonprofit organizations, city's expertise, products, and services are harnessed to help expand opportunity for all. And finally, the National Disability Institute is a national nonprofit organization dedicated to building a better economic future for people with disabilities. Sorry, next slide. We are a national organization committed exclusively to championing economic empowerment, financial education, asset development, and financial stability for all persons with disabilities. NDI affects change through public education, policy development, training, technical assistance, and innovative initiatives. And now I would like to introduce one of our speakers today, Alma Rojas. Alma is a financial counselor with the New York Legal Assistance Group, NYLAC. She has over 10 years of experience in the financial security field, working and volunteering at NYC VITA tax sites, and working as a financial coach on local and national projects. Alma, thank you for joining us.
Thank you, Maria. We're so very happy to be here with everyone today on this webinar. So as Maria said, I work for New York Legal Assistance Group, which has had a financial counseling division for many, many years, serving the people of New York City, offering free financial counseling. But to get started with today's webinar, we're going to go over the benefits of tracking expenses. Next slide, please. We're going to go over the benefits of tracking expenses, the ins and outs of a spending plan, and some best practices that you can then share with the individuals that you serve. And I wanted to say a few notes on terminology before we begin the presentation. Although we will be using the term spending plan and budget interchangeably throughout the presentation, I do want to note that the term budget may have negative connotation for customers because a budget is often seen as an exercise in restriction rather than empowerment. So as a field, we're moving more towards the term spending plan, which looks at the tracking of income and expenses from an intentional standpoint. But since many of our customers and many service providers in general still use the word budget, I'll use that term during this presentation, but know that I'm really talking about a spending plan. And I'm also going to be using the term customer to refer to the people and individuals that we all serve. Next slide, please. So before we look at the details of a spending plan and best practices, it's important to know why it's a good idea to track expenses in the first place. So let's just take a few minutes to think about this question, and if you could type your response in the chat box, we would really appreciate it. So just in general, an answer to why tracking expenses are important. All right, next slide, please. So as many of you have guessed, it's very important for everyone to know where their money is going. Tracking expenses are going to help customers reconcile the differences between planned and actual expenses. It's also going to help customers prioritize their spending. And seeing the numbers in a tangible format can lead to customers having that aha moment or a wake-up call. So it's important that as a service provider, we maintain a judgment-free zone so that customers feel comfortable creating a spending plan that works best for them. Tracking expenses is the first great step towards creating a spending plan, which then helps customers create action plans towards financial empowerment and a financially secure future. With a spending plan, customers can create plans to fund financial goals or major purchases, and examples of a goal can include getting an apartment, creating an emergency savings fund, saving for educational or assistive technology, and saving for medical expenses, or saving for vacations and gifts. With a spending plan, customers can also create a plan to pay down debts. The spending plan would really help identify spending leaks and ways to maximize income for customers. Of course, spending leaks can include a wide variety of things. They can include subscriptions that are hardly used, high-cost plans that can be lowered, and also high spending trends. Tracking expenses is also necessary for customers to secure or maintain benefits. If customers are proactive in tracking expenses, it makes navigating the complex benefit system with the different asset and income limits a bit easier. It will also ensure that they are receiving the accurate amount of benefits that they are entitled to. For example, by keeping track of medical expenses, an otherwise ineligible household may suddenly become eligible for SNAP benefits, or if they're already on SNAP benefits, they may be able to increase that amount. By keeping track of and by reporting their expenses, such as IRWEs or impairment-related work expenses, which we're going to learn more about later on in the presentation, customers can lower their countable earnings and incomes. And of course, tracking expenses is a standard format that can help with audits and other times when customers have to provide proof of expenses and income. Next slide, please.
Alma, this is Maria, and we have a participant that has responded to your poll question and says, you can't know how much you're spending and on what if you don't have a record.
Exactly. I think, that is like in a succinct way what I said. Thank you so much. Yeah, it's true. You need to know, you need to have that record, and we're going to talk about why record keeping is so important in this presentation. But thank you. So for the next two slides, we're going to go into some of the details of what types of incomes, assets, and expenses make up a spending plan. I'm sure we're all familiar with it, but we're just going to summarize it a bit. And like you said, it's important to track income and not just expenses, because knowing their income will allow customers to have an accurate spending plan. Income tracking, just like expense tracking, will also help customers navigate the complex income requirements for different benefits. For example, as service providers, we know that different benefits have different rules when it comes to income. For some benefits, certain income sources may be disregarded, but for other benefits, they're going to be counted towards the countable income, which can then make a customer ineligible for benefits or lower that benefit amount. Thus, it's very important for customers to get into the habit of tracking their income right along with their expenses. And in regards to income, customers should know the type of disability benefit that they're receiving. So whether it's workers' comp, SSI, SSDI, et cetera. They should also know the amount that they're receiving in public benefits like SNAP, cash assistance, housing vouchers, and of course how much they're receiving for each benefit. They should also keep a record of the amount that they earn from working, whether they're self-employed, they're working part-time or full-time, under the table. They should know their gross amount and their net amount, and also any financial support that they're receiving from family and friends or even strangers. For example, they may have a GoFundMe account. Customers should also keep track of periodic and variable income, like tax refunds and investments, as well as any settlement amounts that they receive. And as far as assets, customers should keep an eye on their balances in their checking or savings account, their past accounts, their ABLE accounts, special needs trusts, retirement accounts, IDAs, and other investment vehicles. And while most of these assets will not count against or affect the client's customer's benefits, it's nonetheless a good idea for people to get into the habit of regularly checking these accounts. And as service providers, we can help them establish this habit by suggesting best practices. Now let's take a look at the type of expenses customers should be tracking. On this slide, we've broken them into 3 categories: fixed expenses, periodic expenses, and variable expenses. Fixed expenses are those that typically require a set payment every month, like shelter expenses, rent or mortgages, utilities, which include cell phone, electricity, or gas bills, and monthly medical premiums, whether it's for a private or government health benefit, and any legally mandated child support, and subscriptions such as Apple accounts, Amazon, the gym, periodicals, etc. The periodic expenses are those expenses that can be fixed or variable and do not occur on a regular basis, such as payments towards quarterly or annual taxes, annual subscriptions, any birthday gifts, holiday gifts, etc., and vacation or other trips. And they also include impulse buys. And these are the big purchases that are outside the norm of a customer's life. The variable expenses are those whose amounts vary from week to week or month to month, but that occur on a regular basis. And included in this category, as you can see, are food, groceries, eating out for lunch or dinner, going out to eat at restaurants, personal care items or needs, laundry, toothpaste, etc., any pet or service animal cost, medical expenses, which can include over-the-counter medication or co-payments for a visit. Transportation is a big expense, and that includes MetroCards, taxis, Uber, Access-a-Ride. And we also have the out-of-pocket expenses that customers pay to go to work. And also very important to track savings to bank accounts, past accounts, retirement accounts, any money pool or lending circles such as SUSUs or Tandas. Customers should also be tracking their entertainment costs when they go out to eat or to the museum or to parties, etc. And also tracking charity donations, subscriptions, and any bills or debts that include credit cards, loans. They can be personal or government debts. And so those expenses can be, so it's important to know that some expenses can be considered fixed if they're only paying a set amount, but a lot of expenses are going to kind of fluctuate between the periodic and variable expenses. But the next question for everyone here is, how do you track expenses, right? There's so much stuff to track, and there's so many ways to track them. So how do you personally track your expenses, or how have you seen customers track expenses? If you could type your responses in the chat box below, I'd appreciate it.
We have a quiet group today, Alma, but I know some clients that are, what they do is they use envelopes. They put their income in an envelope, and that's for bill payments, or that another envelope is for rent or miscellaneous expenses. Yeah.
Yeah, that's true. The envelope is very, very popular method. And I saw someone also just type that they provide clients with a monthly spending journal because it allows them to keep track of daily expenses. Yes, that's perfect, especially if you're the one providing it, because that gives clients a systemized way to think of their expenses. And someone else said mint.com, or using a notebook to track weekly and monthly. Yep. And as we'll see, it's okay and to use multiple methods, and a lot of people will do that. And next slide, please. Yep, because there is really no wrong way to track expenses, and everyone tracks their income and expenses a bit differently. And some ways that we've seen and that have been mentioned is that shoebox or folder envelope method. This is where customers keep all the receipts, bills, and income statements in a physical location. And, you know, people may decide to lump all the bills together or break them down into different categories, folders or envelopes. And, it is valuable for customers to try to group these expenses into broader categories, such as transportation expenses or health expenses, which could then be submitted to Social Security Administration as an IRWE. And as a financial counselor and as a service provider, we can certainly step in and help customers do that. The paper and pen method that was mentioned, someone mentioned a notebook or a journal. Yes, very popular still. Customers may use notebooks, worksheets, or personal planners to write down their expenses. Customers may also use their phones. Some people like to take photos of receipts or record voice memos of their expenses to jot down later, or to transfer them to a notebook or software program. And some popular software programs that are out there are QuickBooks or Excel. And nowadays with the internet, there are a lot of software options, and many community-based organizations and nonprofits have also created their own budgets and that they're sharing with customers. And you can find tracking sheets and budget plans in a PDF format from NDI and the Consumer Financial Protection Bureau. If a customer frequently uses their debit or credit card or is tech-savvy, then an online software or personal finance app like Mint, or you need a budget or a bank app like Better Money Habits from Bank of America, or City Financial Tools may need an option. And these are really great because the apps will do a lot of the work for customers as far as organizing the debt and recognizing trends and making it like really visual for customers. And they also have other tools that people can find helpful, such as goal tracking or financial literacy and education courses. And then at the end of the presentation, we're going to share some links with everyone as well. And customers might find it difficult and overwhelming to start tracking expenses in a consistent manner. It's one thing that we're always talking about as service providers, usually during the intake process, and it's something that we might find clients very reluctant and hesitant to talk about. But as counselors and service providers, we can kind of help them tackle the task in very incremental steps. In an initial financial counseling session, counselors are going to create a general spending plan with the customer that includes estimated amounts. So they're going to review the budget with customers to see if it makes sense, and then recommend that the customer begin tracking 2 to 4 weeks of expenses in time for a follow-up appointment. And then customers can also begin tracking their or begin organizing any existing paperwork that they have. In the follow-up session, the counselor and customer together are going to adjust that preliminary budget with the information that they now have and tweak the spending plan a little bit more to make it optimized for the client. And as customers begin to track expenses, it's going to be very important that they also keep track of important dates, such as, when they're receiving the income, the day and the week that it was received, the due dates for bills and debts, as well as the amount. And they can also keep track of the date that they need to mail those bills, because a lot of times they'll provide, creditors will look for that postmark, and so it's important to keep the envelope or a receipt as well. And perhaps most importantly, the dates that customers need to submit required documents to HRA or Social Security is very, very important. So creating a calendar alert may be a good idea for customers who find it hard to keep track of when to mail out or when to pay a debt. It's also very valuable to remind customers that it might be possible in some cases to ask companies to change the date when bills are due in order for them to set up a bill payment date that works best for them. And some other best practices to create a successful tracking habit, customers and counselors or service providers should work to find a tracking method and spending plan that fits best with the customer's personality, their lifestyle, and their needs. And so working together, they can determine how often a customer wants to review their expenses. It can be a daily, weekly, monthly, or a seasonal exercise. But it's important that customers check in regularly with their expenses and at least more than once a year. And so we usually recommend at least quarterly or whenever there is a significant life event or change. But if individuals are working, then it's even more critical that they track income and work incentives and other expenses on a monthly basis, and we're going to find out why later on in the presentation. But it makes it more convenient. By regularly tracking your income and expenses, it's more convenient for customers and makes it less likely that they're going to be tracking a critical expense. Customers should also or may want to find ways to hold themselves accountable. They can schedule a time and a place to review their expenses, do data entry, and they can use technology for this, or they can find an accountability partner, such as a friend, a family member, or a financial counselor. Customers should also try out different tracking methods to find out what works for them, what works best for them. For some customers, simple is best. Other customers may be interested in utilizing tools that have a lot of bells and whistles, and some customers may want to use multiple methods. For example, I personally like to use my bank's mobile app as well as Mint and an Excel sheet. And although these are all tracking my spending, each tool has a different purpose for me, and I don't find it burdensome. But for other people, that may be a bit too much or maybe not enough. Some people like to track their expenses daily, and for me that would be a very tall order, but for others it's what's necessary and what keeps them accountable to their spending. Again, customers just need to find whatever method works best for them. And customers should identify potential obstacles and barriers to tracking their tracking method. Tracking expenses and creating a spending plan or a budget may be difficult when customers are starting out. Because there's often so many components to that spending plan. We saw two different slides, just one for income and one for expenses, and they're all very wordy. And so customers may have questions regarding what income sources to track and what type of expenses to track, or if it's even necessary to track a small expense. But as a financial counselor, my answer is track everything, because you never know what may be useful to report to Social Security or to HRA. And again, if you don't know what you're spending on, it's very hard for you to create an action plan. But customers may need assistance in grouping the expenses, and that's where financial counselors step in. And another common barrier that I want to mention is an unwillingness to track an expense, because a customer may feel undue shame, especially when customers are sharing their budgets with another person. they are in a very vulnerable position because expenses are deeply personal. And although they may be used to reporting their income or their expenses to apply for benefits, they're also used to just budgeting and like their expenses in a standard like general wants versus needs category. And as service providers, we need to maintain that judgment-free zone. It's very critical that we're not the ones determining which expenses fall into each category, and that it's up to the customer to make that decision. We can only ask guiding questions to help the customer prioritize their expenses or find ways to lower those expenses. For example, we may have a customer who spends a lot on coffee. Our initial instinct may be to recommend that a customer stop this expense because it seems miscellaneous to us and really expensive. However, when we ask those guiding questions, we find that the customer is buying coffee as a self-care mechanism or as a ritual before attending an important or a very stressful meeting. And forcing customers to take away that expense may lead to detrimental effects for both the customer and the counselor. For the customer, they may not want to track expenses at all. And for counselors, it means that the customer may not be willing to return for a follow-up session. But we can help customers realize that, you can have that coffee, but you may need to compromise on another expense in order to maintain a balanced budget. And so it's, again, very critical that we help customers realize that not everybody's budget is going to look the same and that that's totally fine. And we really want to make sure, again, that customers are tracking and that they're keeping copies of all their expenses, such as IRWEs, medical bills that are submitted to SSA or HRA. They should keep the receipts that they receive also when they submitted those documents. Maintain good record keeping is very important for our customers, especially because later on they will most likely have to provide proof that they did submit it, and that receipt is going to tell them, yes, I submitted this document on this date to this person. But ultimately, we want customers to see tracking expenses as a way to increase their personal and financial empowerment, and we want them to be the driver and to recognize and acknowledge that they are the experts in their own lives. And as counselors and service providers, we can and should acknowledge that customers are already keeping some sort of budget. And really our role is just to help them optimize that exercise that they're already doing. So again, as you see on the slide, key is always to personalize the spending plan because that can help with spending prioritization, identifying spending leaks and ways to increase income and assets. And again, very important to use this spending plan as a step one to creating an action plan to achieve financial goals or to pay down debt. And as we're here in New York City launching this great initiative. So if you need any help or if you identify any customer that may need help creating the spending plan, please refer them to an EmpoweredNYC financial counselor. And back to Maria. Oh, yes, sorry. Some spending plan resources that we mentioned and that others mentioned. There's Mint. That's the link there. It's free. There's also a NerdWallet article with budgets and templates, and they're all downloadable, but I do want to note that proceed with caution whenever you're downloading a document from an online website. Just make sure that you trust the source. There's also the Consumer Financial Protection Bureau's Your Money, Your Goals Toolkit, and that includes companion guides with fillable PDFs. And also NDI has a really great financial education toolkit with a spending plan and also a spending tracker, so a weekly spending tracker where everyone can track their daily expenses. And customers should also contact their personal bank to see if they have any online banking or mobile app that tracks expenses. But thank you so much for listening, and I'm going to pass it now back to Maria.
Thank you, Alma. We wanted to ask you if there were any questions from participants. If you've seen any issues with your clients that you want to ask Alma, this would be a great time. So as we get questions, let me ask you, Alma, one question that we have. Is a spending plan different from a budget?
A great question. I think, both a spending plan and a budget have the same components. They're both tracking income and expenses, but as a tool, they have very different purposes. For me, a budget is a way, it's looking for ways to reduce expenses based on a wants versus needs method, but it also has a very restrictive definition of what those categories mean. Whereas a spending plan, on the other hand, is what it says. It's a plan for spending. So it's very individualized, and therefore, no one has the same spending plan, but it's also more lenient on the miscellaneous expenses. So I think it's all about how to use it as a tool.
Thank you, and I like a lot what you just shared with us, that we need to be careful to keep a judgment-free zone, and that framing this exercise of tracking spending as an empowerment tool, right, as helping you achieve what you want rather than as a constraining activity. I think it's very helpful.
Mm-hmm.
Let me ask you another question. If a person has hours, working hours that vary week to week, how could they budget earnings if they fluctuate that much?
Yeah, this is something that many individuals are facing today, and it's very hard, I think. And that's why it's even more critical that they're creating a spending plan and tracking their income and expenses. I would say, begin by tracking those daily and weekly income and expenses, and then at the end of the month, averaging out that income and expense, and do an exercise maybe for 3 months, watching for trends, for any trends. And with customers that have fluctuating earnings, it's very important for them to create a savings or an emergency fund. That way they can be prepared for weeks where they know in advance that they are going to have a low income or a very high expense week. And for customers who have fluctuating income, they may want to move the bills around to a week where the expense is not going to have that much of a negative impact on their overall spending plan.
Thank you, Alma. I want to give you one more question. So can you tell us a bit more about the snowball method for paying down debt?
The snowball method, it's all about paying the small bills first, and then using that money once you accomplish paying off that small bill, using that money to pay off a bigger bill. And it's a very great method for clients because it gives them a sense of accomplishment, and then they can use that momentum to tackle the bigger bills. Long term, it's probably a bit more expensive because you can use the avalanche methods, which is the opposite, where clients and customers can tackle those big bills first and then the small bills. And when you take into account interest, they're going to be saving more. But it really just depends on the person. I prefer the snowball method, even as a financial counselor, knowing that I will probably save more using the avalanche method. But again, it's all about preference.
Thank you, Alma. And Jamie, we have a question about, is there a pre-printed sheet with the IRWEs and when working? Is there a new sheet? I had one from the Coalition of Behavioral Agencies in New York City. Is there an updated one? I don't know if you know about that.
So we do have a slide coming up that has a link. I'm not sure if that's a new or updated one or not, Maria, so we'll have to take a look at that.
Okay, thank you. So with that, thank you so much, Alma, for your insights. And again, to go back to what Alma said, if you have at any moment clients that need financial counseling, we are providing the service now, and later on in the presentation, we'll show you how clients can make appointments. So thank you, Alma. Next slide. So in the next part of the presentation, we'll talk about disability-related expenses, and our presenter is Jamie Robinson. We're very excited that she's here with us. And Jamie's a manager for financial empowerment and workforce at National Disability Institute.
Thanks, Maria. Thanks, everyone. And also thanks, Alma. That was great information. So just a little bit of background. I have worked in the disability and the deaf community for almost 20 years now, mostly around employment and financial empowerment. And one of my roles along the way has been as a work incentives benefits counselor, primarily in the deaf community. And it was work that really made a tremendous impact on me in terms of kind of really understanding how important it is to help people to learn all of the information that they can so that they can make their own informed decisions about work, about earnings, about their independence. So while some of this information on SSI, SSDI, the work incentives can be a bit confusing and kind of overwhelming or frustrating at times, it's really worth working through those challenges, you know, getting the right help and support and applying the work incentives to ensure that people can reach their financial goals. So next slide. So there are a lot of incredible work incentives that exist, and I encourage you to connect with the Work Incentives Planning and Assistance Program near you for more individual support, especially because these counselors kind of live and breathe this information every day, and they typically have relationships with the local Social Security offices that can, you know, be a really critical bridge to you all as providers and customers and consumers. And today we're going to look at IRWEs. An IRWE, or an impairment-related work expense, enables SSI beneficiaries to reduce their countable earnings due to out-of-pocket expenses that support their disability-related employment needs and their disability-related employment support needs. So for an IRWE expense to be allowable, it must be directly related to supporting the disability. The cost must be paid out of a person's pocket and not covered by other funding sources, such as medical insurance or Medicaid. Expense must be paid in a month the wages are earned or had been earned, and the expense must be reasonable. So there are cases where a person might have to make that case for an IRWE. So there's kind of three major things to remember here. It's an item that I've paid for myself that's related to my disability that ultimately allows me to go to work. And if the item appears to kind of meet those three criteria, they should definitely be submitted as an IRWE, and the person should request, beneficiary should request that they be considered for deduction. Next slide, please. So keep in mind when you're looking at all these calculations here, you don't need to know how to calculate everything, but you really just need to know that these are the kinds of calculations that Social Security are doing and that are involved, and most importantly, kind of what is your part in tracking some of these items and submitting you know, your receipts and other proof to ensure that you are really getting an accurate amount back. So let's take a look at the calculation here. So we're going to assume that Anna has no unearned income, and that would be all income that's not earned as maybe Social Security benefits, pensions, unemployment benefits, also cash from friends and relatives. We'll also assume she's eligible for the full federal SSI benefit rate of $750 per month, and she doesn't receive the New York State supplement. So Anna is working part-time, and she's using paratransit service to get to work. She earns $15 per hour and works 28 hours per week, and so she's earning $1,680 per month. She's using paratransit services that cost $5 per trip, and she's working 5 days a week, so that's a total of 10 trips. And so to calculate the IRWE, we take the $5 per trip times the 10 trips times 4 weeks, and that gives you a total IRWE of $200 for the month. So to calculate Anna's new SSI amount, we start with her $1,680 in gross wages, subtract the general income exclusion. We'll also subtract the earned income exclusion. That leaves her a total of $1,595. And normally this is kind of where we divide by 2 in SSI calculations, but now we're going to use the IRWE calculation and subtract $200, and you have a new subtotal of $1,395. And now this is where Social Security will divide by 2, and her total countable earned income is now $697.50. So remember, without the IRWE submitted, Anna may likely not receive an SSI check to supplement her earnings. So the total countable earned income is $697.50, and that's subtracted from the federal SSI benefit rate of $750. And her adjustable SSI payment will be $52.50. So this is what would be added to her gross wages. And keep in mind, she would continue to pay that $200 towards paratransit out of her own pocket. And so you see here it's subtracted, and her monthly take-home would be $1,532.50, more than when she did not submit for an IRWE. So lots of individual, very individual cases for people, and that's why it's so important to work closely with your WIPA, with possibly a financial counselor that's been through training, that understands how to do this. Really important to kind of do that together to make sure that you're kind of getting all of the correct calculations. Next slide, please. So some other kind of key points about IRWEs are that there are no time limits in using an IRWE. An individual can use an IRWE for as long as he or she needs. So for example, if the cost of monthly paratransit services, there's no limit, time limit on using that IRWE. Any month the individual uses that kind of paratransit, they could use it as a deduction. And the IRWEs do not have to be a monthly expense. So it can be something that an individual uses intermittently, or it can be something that they paid for just once during the month. And IRWEs may be a one-time expense deducted all in one month, or it can actually be spread out over several months while earning wages. So for example, if someone had to have their vehicle modified, that could count as an IRWE. And that's something that the person paid for themselves. It allows them to go to work. It relates to their disability. And it's something that could be very costly. So the individual might choose to request that this expense is deducted over several months rather than the full deduction taken in 1 month. So when an individual is going to use an IRWE, they want to make sure that they report it properly. And this is really key. The first month the individual uses an IRWE, they should make an appointment to submit the receipts and the reason for the cost along with their pay stubs to their local Social Security field office. And the SSI claims representatives will review the IRWEs, and if it's approved, adjust the benefit. The person should discuss with the claims representative the frequency in which they will need to report IRWE expenses, and the individual should continue to keep receipts in the event Social Security requests proof of expenses. So sometimes this process here can be overwhelming to really anybody. Anybody. There's lots of steps, right? So there are different providers out there that will offer support, and I just want to mention Centers for Independent Living. They typically have more than half of their staff have people with disabilities themselves, and they understand what this process is like and have been through it often. And so they can advocate and support people kind of through this process. So what you really want to remember here is keeping the receipts, a really huge component of IRWE, and they should be kept along with the pay stubs and anything else that was submitted to the Social Security office. All should be copied beforehand so that everyone has copies of everything they're submitting. Again, it can be a lot of steps. so the support piece is also important. Next slide. So for individuals who meet Social Security's definition of blindness, they have a unique work expense called blind work expenses. And these allow blind SSI beneficiaries to reduce their accountable earnings due to any cost incurred to go to work. So it might kind of at first glance think, well, isn't this just an IRWE? But actually, they really allow blind people to deduct a lot more. And I think remembering the IRWE's rule was kind of anything paid for myself to go to work because of my disability. For blind work expenses, it's anything I paid for myself to go to work, and it does not have to be related to the individual's disability. It's anything I paid for myself to go to work. And so any cost incurred for me to go to work could be guide dog costs, transportation, not necessarily paratransit, equipment, services, meals, childcare, and I'll actually go back to meals for the guide dog too. So it's really important to make sure that Social Security has a definition of blindness for a person who might have multiple disabilities. I work again in the deaf community, and they typically are, there's a deaf-blind community, and sometimes they really have to make sure they have blindness. They meet that definition of blindness and make sure the office knows because of things like this and work incentives like this to make sure that they can take advantage of it. Next slide. So here is a blind work exclusion calculation for you. Randy is working part-time. He earns $16 an hour and works 30 hours a week, and he's earning $1,920 a month. His pay stub shows that Randy paid $200 in taxes this month. He also pays $600 per month for childcare, and Randy is blind. He is requesting the taxes and the child care cost be deducted as a blind work expense. And actually, as you probably saw in the last slide, taxes was at the very top of a blind work exclusion, which is pretty amazing and a great part of this incentive. So when you look at the calculation, again, assuming Randy has no unearned income, the general income exclusion and earned income exclusion are subtracted. And then you can see Social Security divides by 2 before subtracting the blind work expense. So he's able to deduct all of his blind work expenses, the taxes and the child care, before Social Security adjusts his SSI check. And so this means that even though Randy's earning $1,920 in gross wages, he still receives an SSI check of $632.50 due to his blind work expenses, which is a great benefit. Next slide. Okay, so here's that link I was talking about, Maria. So this is what I have in terms of the IRWE request template and reporting wages by fax or mail. Here's the link that I've been given. So hopefully that's an updated one. But you can download and use the forms to report your wages and your IRWEs and your blind work expenses. And you should also know that you cannot do this over the phone. You have to either do it in person or through fax or mail. And so that's a key part. Maria, do you know if this is the form that you're looking for, or do the forms exist from this link that you're looking for?
Yes, I think there's an IRWE form there that we created that they can be accessed.
Yes, there is an IRWE form there. I just wasn't sure if there was an updated one, but So you created
yeah,
that
we
for?
put it, yeah, Nancy created it for this webinar this week, so I think it should be the most up to date.
Well, I was going to say that's an excellent idea to have a form like that, and from somebody who is a benefits specialist to know exactly what they're looking for. It's so important, and half the battle is really making sure that Social Security gets the information, processes it, has any questions, asks them. So you really can't just rely on, okay, here's my IRWE. Hopefully everything goes okay. You know, you really have to have some type of communication going with Social Security to ensure that this is being processed accurately. And the last slide here. So just one thing that should be considered is that individuals should always check, which I've kind of mentioned, that Social Security has them noted as blind. So if you're working with people with multiple disabilities and blindness is one of them, you definitely want to take a look at that. Because, again, I'll just mention that there are many people who are losing their sight over time. Many deaf people have something called Usher syndrome, which means they're deaf and they go blind, or they're blind and they go deaf. And so that's something you might encounter. An individual who needs to report blind work expenses should definitely make that appointment to submit their receipts, the reason for the cost with their pay stubs. The claims representative will review it, and they are meant to kind of consider all of the evidence, and if it's approved, they'll adjust the benefit accordingly. And the individual should also discuss the frequency in which they should, return, to submit further blind work expenses, and kind of develop a system to kind of keep receipts, make sure that they're getting everything that Social Security wants them to keep or submit in terms of proof of expenses. Because with blind expenses, there can be a lot more, a lot more than with the IRWE. So you've got to be careful. Oh, go ahead, Maria.
Thank you, Jamie. Thank you. So we have 3 more minutes, so we want to move forward. And what we want to do is ask you to apply this knowledge to your personal expenses, and also share this information and resources with the individuals that you serve. And as we mentioned earlier in the presentation, we're so excited because we're finally able to open the service of offering financial counseling to people with disabilities. If you have clients that you work with that you want to refer them to the service, here is the link where they can go to make an appointment. It's the Empowered New York City page, and the link to book an appointment is in the first part of the website. Here's the number where they can call for ASL Direct by video as well. So please send us your clients that you think will need support with the service. On the next slide, you will see our contact information if you need additional support. And again, we will send the PDF to participants for the PDF of the slides, and in 2 weeks you will have the recording of this presentation. And then we want to, on the next slide, open it for questions for Jamie. Let us know if you have any questions for her. As we let participants think of any questions, Jamie, could you share with us, if a person gets a job and needs to pay for an attendant care services on the job, could that be considered an IRWE?
Yeah, definitely. I mean, it depends on every kind of situation. So an attendant care could be you need it in order to work in your work environment. That would be probably an IRWE. If you have attendant services on non-work days, that wouldn't be. So if you have an attendant care where services, right, it depends all on kind of, let's say you need services to help you prepare for work, to get ready for work, that probably would be an IRWE.
Great. And Jamie, can IRWEs be retroactive?
So that kind of depends. It kind of depends on your Social Security office and your claims rep, but I would always say to try. And I've seen definitely IRWEs be retroactive, but it's just not consistent, unfortunately. But I would say up to the past 11 or 12 months, you could give that a try.
Thank you, Jamie, so much for being on our panel, on our webinar. And then the last slide, we want to, of course, invite you to join us for our next webinar in January. And the title is How to Prepare for Tax Time, Free Tax Prep, VITA, AARP. Sign the link to register is there. And we want to ask you in a very special way to help us answer the survey that will pop up in your screen right after the webinar is done. We really need your input to make sure that these webinars are responding to your need and that we're finding topics that are useful and valuable to you. So please help us answer the survey, and thank you to our presenters, and thank you for your time this afternoon. Bye-bye.